Good afternoon and welcome to the OR Today webinar series. We're excited to have over 230 registered attendees for today's webinar. Just a reminder to save the date for our 5th annual OR Today Live Surgical Conference, which will take place on August the 18th to 20th in Las Vegas, 2019. Join us at the Palms Casino Resort and Spa to discover new opportunities, broaden your knowledge, and exchange ideas. Visit ortodaylive.com for more information. Let's kick off today's webinar by giving an OR Today Live surprise pack to the attendee that can tell me the answer to the following trivia question. In Charles Dickens' A Christmas Carol, what was Scrooge's first name? Answer now using the questions feature on your dashboard. While you're answering, I want to remind you today's webinar is eligible for one continuing education hour. To obtain your certificate, you must complete the post-webinar survey, which will appear immediately on your computer screen at the end of today's call. One lucky attendee will have the opportunity to win an Amazon gift card, courtesy of OR Today, just for completing the survey. Okay, and let's see who the winner of our OR Today Live surprise pack is. And it is Angela Lampini. Congratulations, Angela. The correct answer is Ebenezer. Our presenter today is Jim Stabinsky, CEO of the CCI. Jim, you may begin whenever you're ready.
All right, thanks, Linda. And Linda will be monitoring the presentation, so if at any time there's any issues with audio, technical problems, please send a message into Linda, and she'll attend to that. So this is today's presentation. Thank you so much for being here. Our presentation, Professional Development in Healthcare is Changing. What choice will you make? And also, I sent some slides ahead to Linda, and those are available to you. There's going to be a couple of updates. I did a little work on the slides this morning. None of these are that large, but you will not be able to follow page for page, but you have the basis for the information. You do have almost all of it, and if you have any further questions, you want the absolute last-minute version, my contact information will be at the end of the presentation. Send me an email, and I will send you the complete, most current version of the slides. So again, good afternoon. I'm based in Denver. It's a little afternoon here in the Mile High City. Let's get started. This is me, the most current picture. I'm the CEO of CCI, and I'm also an operating room nurse. And I've been an operating room nurse for 30 plus years. And I should also tell you, I'm an adjunct professor. I teach nursing students, mainly graduate students and doctoral candidates, at both Nova Southeastern University and Wilkes University in Pennsylvania. And I hold the CNOR credential. I am in emeritus status for CSSM. I helped to develop that credential. And I can tell you here at CCI, we have a very strong interest in nursing professional development, continuing education, and certification. Obviously, it's our business. So with that being said, here are our objectives. I will tell you about a number of changes that affect our duties as professional nurses, as registered nurses working in the operating room. I will discuss at least 2 factors that influence change in professional development and how that's done in American healthcare for nursing. I'm actually going to tell you quite a few factors, but at least 2 I hope that you can take away. And talk to you about one healthcare organization that has influence on nursing professional development in the operating room. As the CEO of CCI, I am required to share this disclaimer. I will not read the disclaimer, but basically, just because we do certification, the fact that you listen to our webinars, any of that, you're not required to do that to take our certification exams, and you gain no special advantage just listening to me or us doing CE presentations. This is an accreditation requirement, and I am required to share it. So I have, and let's start with 2 questions. So these are polling questions. I'm going to put the first question up. You are able to answer the poll, which Linda controls, and then Linda will return onto the line, and she will give us the results from the poll. So our first question, do you hold an accredited certification? And let me clarify. If you hold ACLS, NALS, PALS, BLS, by definition, and this is the magnet definition, the ANCC magnet program, those are training programs. They're not certifications. So a certification by definition, CAPA, CPAN, CNOR, any number of other credentials, certified emergency room nurse, those sorts of things, those are certifications. And also training certificates like certificates of mastery. You spend a weekend studying a given subject, again, not certifications. So Linda, do we have our polling results?
Yes, Jim, we do. We've got 90% said yes and 10% said no.
All right. So now we'll move on to our second question. What percentage of your time do you spend in professional development activities? These are your own personal activities. What do you do for yourself for your professional development? And we have 4 choices. Not applicable, just don't have the time. It's not part of your regular work. 5%, 10%, 20% or more. And I would imagine the 20% people are perhaps those that are in graduate school. They're taking some sort of certificate series. But again, Linda has the poll. I see that it's open. And Linda, please let me know when you have the results.
Okay, I have just closed it, Jim, and it said 6% is not applicable, 28% is 5%, 31% for 10%, and 36% of 20% or more.
Excellent. That is actually higher than I had thought, but it's a very nice lead-in. So let's begin talking about professional development choices for nurses that work in the operating room. And then I do have another polling question at the very end. But let's get into the material. So I don't think this statement should be a surprise to anyone working in the operating room. American healthcare is changing rapidly. And this one slide, there's probably no better slide that I could think of that shows you how rapidly it is. This is the number of hospitals in the United States from 1975 to the year 2016. I can also tell you that the trend here is clear. There are a commonly used numbers, 5534. Those are 2016 numbers. It's probably a few less because there's a handful of hospitals that close each year, mainly in rural areas, but then some from, hospitals being realigned, combinations, strategic partnerships. And so we have less hospitals, but we have other healthcare facilities, and many of these do surgeries. Micro hospitals, we may have less hospitals, but we could have ambulatory surgery centers. So the places where we deliver care are changing. This is important for membership organizations, for organizations like CCI. Traditionally, our certifications and how we reach people to do professional development is in a hospital setting. And the hospital settings, there are less and less hospitals. They may be bigger and they may be more complex, but there's less hospitals. So the sites where we deliver care particularly surgery, are changing, and there's an ever greater shift to ambulatory settings. And some of us who have been in this field for a long time remember that when someone used to come for a total joint procedure at your facility, their stay would be measured in days. It is not unusual now that in ambulance you can have a total joint done, a total knee, and go home that evening. It is entirely possible. So healthcare is changing rapidly, and we are now in very uncertain times. And I like to use this slide because we're in shifting seas right now. It's a bit difficult to get our bearings. And that's in healthcare in general, but it also carries over to our professional development efforts, certifications, how we approach that. All of this, we're in a bit of a shifting landscape in, frankly, some rough seas. For those of you who are every day in an operating room leading, you are acutely aware of this. But I will say that healthcare, American healthcare is changing, and our job is becoming more complex, which leads us into our professional development needs. And I should acknowledge this canvas comes from the Toledo Museum of Art, and they did give me permission to use it in my presentations. And so that acknowledgement is on the bottom of the slide. So I've told you that I've been in the operating room for 30 plus years, and now I do administrative work in nursing. But let's go way back when I first entered nursing in the mid-1980s. And I didn't say this earlier, you saw my credentials, but I got my start in nursing as a diploma nurse. And I very strongly identify with that still. I hold a diploma of nursing from Toledo Hospital School of Nursing in Toledo, Ohio. And when I entered nursing in the mid-80s, our relationship with the rest of the staff that worked in the operating room was very clear. Our instructors told us that everyone in that room, the surgical techs, the people that work in central supply, sterilization, all of those people are working under your license and you have supervisory responsibility. And we were the ones that were in the room supervising staff that did not have college degrees. And so we had a degree, we were registered, and we use that phrase all the time, they work under our license. That situation is changing. And it's a bit of a different world for those that are entering nursing now. If we look at statements like this from Amy, I became aware of this statement a few months back, and it caused quite a stir in the facility that I was visiting. So we have a statement from Amy which carries considerable weight. These statements from Amy end up in things like the guidelines for perioperative practice, and Amy has made a recommendation that supervisors complete a sterile processing management certification exam, and that other personnel performing sterile processing activities should be certified within 2 years of employment. So often the person supervising the sterile processing area is a registered nurse. So we've changed positions here. We're an outside group. Amy there are nurses engaged with Amy, but they have a far wider reach. The point here being organizations outside of nursing are making recommendations about nurses being certified, how they perform supervisory duties. This is quite a change. ISHM, so the certification that they talk about, they say they should have a certification, supervisors to make recommendations. ISHM, as you can see from this slide here, they have the CHL exam, a secondary certification for CS management. Most of ISHM's business involves central processing professionals, but they also do certifications which nurses can earn. So when you have recommendations and things like Amy that eventually may work themselves into advisories to the Joint Commission, et cetera, you can see that the landscape is changing. And nursing is one among many professions in the operating room, but we don't have the only opinion about how care is rendered, supervised, and it's conducted in the operating room. Surgical techs, the Association of Surgical Technologists, they have recommendations like this about entry to practice, where formerly the other groups would be under our supervision and basically went along with that. We have groups like ISHM, AST that are now saying, but we have our own opinion. And nurses are not the only ones in the operating room that have college degrees, and they're being very assertive and they're lobbying. And this is a different environment for nursing, much different than when I entered the profession. So what's driving all of these changes in healthcare, and how do nurses react? So I'm saying the role of nursing is changing. There are other factors involved here. When we're in the current value-based purchasing environment, consumer expectations, their stake in healthcare, how much they have to pay, it's high. And they have high expectations, and they've also figured out when they're being asked to assess the quality of their care, where your pain, your needs relative to pain medications, were they met, the staff was courteous, these sorts of things, they figured out that they have a say in their care. So their expectations are higher. Also, there's changes in the relationship between the facility and the nurse. Things that were taken for granted years ago for nurses, that you would have a defined benefit retirement plan, you would have a long career at one facility. Those sorts of things are not common anymore. There's also reluctance. We hear this, many employers are reluctant to invest in the professional development of their nurses, especially in the operating room, because we have such a long orientation period. They would much rather get an experienced nurse than invest all of this in a nurse who may not stay their entire career at their facility. So how this plays out for nurses, realizing all of this and the increased expectations and the change in their role relative to other health professions, many nurses choose to strengthen their individual credentials and invest in their education and basically take care of themselves in their career. In an uncertain environment that we're in now in American healthcare, many nurses made the choice they would invest in their own education, their professional development, so that they had more opportunities throughout their career and they could take advantage for this from a career perspective. So in this very uncertain environment, how can nursing react to these changes? What choices could we make? I suggest one course of action. And this is from the perspective of someone who has a heavy engagement in professional development. I think that we could turn a bit inward, and we can think about what we can do to strengthen ourselves as a profession. And so let's switch now from the nature of the role of nursing, and let's talk about the influences on personal development. So one big influence are the accreditation bodies that are engaged here. Now I'm going to talk to you about two bodies, NCCA and ABS&C. And also, full disclosure, I am the president of the board of ABS&C. I'll explain what each organization is, but it gives me a unique perspective. For nursing certification organizations, the vast majority of them are accredited because it ties into recognition from the ANCC Magnet program, your marketability, how desirable your credential is. The vast majority are accredited by one of these two organizations, and Let me explain a little bit more about each one. NCCA, they accredit a wide range of programs. They have a very heavy emphasis in nursing and other healthcare professions, but they also accredit things like fitness coaches, financial advisors, auto mechanics, software engineers, a wide variety of things, but many nursing organizations, medical boards, medical professionals, their organizations are accredited, their credentials are accredited through NCCA. So they accredit certifications and they also accredit certificates of mastery. NCCA is re-examining the whole nature of certification, accreditation processes for certification, and they're asking very foundational questions. What value does certification hold? Should we change our methods to better address the needs of stakeholders and in environments like healthcare, the demands of the consumer? Should we change to meet these needs? They're also asking questions and doing a considerable amount of research to establish the best practices for certification. Currently, when you do certification, testing is very widespread, but the evidence to support some current practices is not strong. They have a particular focus on what we do to maintain our credentials, the recertification methods, and they're re-examining how the accreditation standards apply. The use, in particular, the use of continuing education is being questioned. Tailored professional development activities based on an assessment of learning, needs, and reflection is a current trend, and many organizations are moving in this direction. We attend professional meetings, and at the very recent meeting in November in Austin, Texas, NCCA is the accreditation branch of a larger organization called the Institute for Credentialing Excellence. At this meeting, all of the organizations that you see pictured at the bottom, all of them presented on the changes they were making in their recertification programs. And you'll note that some of these are nursing programs. This is widespread in certification, but particularly in healthcare organizations that have certifications. So let's turn now to ABS&C. ABS&C accredits only nursing programs. Many certification programs in nursing choose to be accredited with ABS&C, and I'll tell you about the volume there. Some choose to be accredited by NCCA, and some choose to be accredited by both, which is a very high standard. For the CNOR credential, it does hold accreditation by both NCCA and ABS&C, and thus has very high standards to maintain, to address the needs or the programs from both organizations. ABS&C accredits 41 nursing certifications, and that is about 260,000 certified nurses. So mind you, on the certified nurses, there are some people that hold more than one credential, like I do. So the actual number of nurses that hold the individual nurses is probably much less than this. But the point being, even if we consider NCCA and ABS&C, the total number of nurses Linda, and am I still okay on my AV?
Yes, you're fine.
I don't know what that warning sign was from Zoom, but I'm going to keep going.
You do that.
ABS&C has 260,000 nurses. The programs range in size from a program that certifies 65 nurses to another program that has 91,000 nurses that are certified by that organization. There are 3.3 million, a little more, registered nurses in the United States. Even if we add up the NCCA numbers, The total number, if we consider the NCCA accredited programs for nurses, there's a minority of the nurses in the United States choose to be certified, and this is a choice. Often for nurses, unless you're advanced practice, you're not required to hold a certification to work. So this is a choice that nurses make, whether to be certified and engage in all those activities to maintain your certifications. It's one of the choices they have available. We don't know the exact number of individual nurses that have one or more certifications. There's a very strong possibility that it's a minority of all the nurses that work in the United States. However, ABS&C has standards about recertification continuing competency. We are required by the accreditation agency to evaluate our programs. Certifying organizations must reassess their search and recert processes periodically, and they must improve the methods of evaluating certificates' competence. So when we talk about the accreditation organizations, this basically, if for the nurses that are certified, this dictates the nature of the program. And both the NCCA and ABS&C are asking these sorts of questions. The applicable standard for ABS&C is Standard 13. When we talk about evaluating your programs, what is the connection to competence and competency? That standard is under revision in the year 2019. We can expect the topics of recertification, continuing competency are going to receive more scrutiny. Expect that the requirements to keep your credentials will be changed and probably strengthened, and that'll be dictated by the accreditation agency. And also the question of relevance is being asked by ABS&C is, are the methods that you're using, even if they've been in place for a long time, are they still relevant in a changing landscape of American healthcare? There are also other organizations that have a big effect on nursing certification. One of the biggest is the ANCC Magnet program. It is an accreditation program for healthcare facilities. Currently, there are 482 hospitals, healthcare organizations that are accredited by ANCC. If we go back to that number of 5534, roughly 8 to 9% of American healthcare facilities are accredited by ANCC. Why is that important? RNs who are employed at magnet facilities are more likely to hold an accredited nursing certification. There's higher levels of BSN level education at these facilities, and also the percentage of nurses that hold graduate level education are higher in magnet facilities. The landscape is different now for certification. Nurses entering the profession in the year 2018 are far more likely to have a BSN than at any time in American nursing history, in the history of the profession in this country. And they have a different view on professionalism if they've attended a BSN program. And this comes from a diploma nurse. The nature of nursing education is changing. The average age of our test takers at CCI, those people taking the CNOR exam, continues to decrease, and nurses entering the profession these days are far less likely to complete their entire career without having eventually attaining BSN level education, and they are also far more likely to seek certification than ever in the past. CCI now, for the CNOR credential, we have 44,000 plus nurses in the world that hold our credential. That's the highest numbers that we've ever had, and we are one of the largest nursing certification organizations in the country. Expectations regarding certification are different. Nurses tend to see certification, for those who do elect to do it, as a career enhancement, a differentiator from others that are in the workforce. they tend to seek certification because they want to have an advantage in the workplace. We know over the course of a career, if you're certified, that you will be paid more over the course of the career. The Air and Salary Survey, which was just recently released, their findings were that nurses with the CNOR certification were found to earn $1,700 more than other nurses that do not hold the credential. And these are the findings from their survey that were released in the last month. Nurses that are certified want different things from their certification than years past. We also have to acknowledge in all of this, there's some nurses who are not going to get certified. They're not in their point in their career where they feel it's worthwhile. There may be no reinforcement from their employer, and without the reinforcement and perhaps some help to get certified, they're not motivated to do it. And for many nurses, not required for employment, it doesn't get reinforced. They don't receive any extra pay. For many nurses, it is simply not worth it to put the extra work in to attain certification and maintain it. Certifying bodies like CCI, in this changing healthcare landscape and changing expectations of nurses, this is the environment that we work in. We have to look forward and we have to plan for the future. We also have to be aware of how accreditation programs for certification are changing. Many nurses consider their credential as a set of initials in something they've earned, and they have expectations about what that means and their relationship to their certification. They don't consider it necessarily a lifelong learning, continual professional development system, but rather it's a credential, it's a set of initials, it's a professional accomplishment, and they tend to have a static view of it. The connection to competency and lifelong learning, professional development, it's not there for many nurses. We have lessons that we can learn from other disciplines and lessons from other countries about the relationship between licensure, professional development, certification. There's lessons that we can learn from other countries. So we have had to change the way that we do certification, and we have a greater emphasis now on professional development and lifelong learning. In the old methods that many nurses are familiar with, that it's just a question of doing CE and turning them in, we've had to change that. I'm going to talk to you about how those changes, but we've announced that recently, within the last year, that our system of recertification methods, use of CE, have changed. How have nurses reacted to that? Not everyone is happy. We've received considerable feedback about why do we need to change recertification? I've done it this way for years. Why do we have to make these choices? Or why are you forcing me to do something different? They literally are telling us it's not what I've signed up for. So if we start at the top of the diagram, many nurses, they do a certification exam, they pass the exam, whatever their motivation is, they pass the exam, they now hold a credential, CNOR, and they do things like attend trade shows, attend membership meetings, and they earn CE and they track it. And it's a very familiar system. And then at an interval, 3 years, 5 years, you pay your fees, you hand in a listing of your CEs, and you keep your credential. But that's changing. This is a picture of a battleship. For those of us that are a little bit more seasoned in the profession, there used to be a term when you were faced with a difficult task, we would say, that's like trying to turn a battleship. And that's the environment that we're in now. This is the USS Texas. It's in San Jacinto Bay, near Houston, Texas, right outside the town near the coast, the city near the coast. It's a very useful analogy. This whole thing of changing our outlook and making different choices about professional development is a difficult task. And CCI is acutely aware of that, and we are taking feedback from our certificates. It's going to be difficult to change this system, but we have choices to make here. In all of this about recertification and competency in professional development, CCI has begun to change our approach. We're trying to emphasize the positive in these changes that are coming to us from the accreditation agencies. We're trying to emphasize the positive. We're trying to meet the expectations of the stakeholders, and that includes the employers who sometimes pay for certification, recertification. We're trying to meet their expectations too, but for our certificates, issues of cost and convenience are right up front for them. And they're changing expectations about when I passed my certification exam 20 years ago, I signed on for a system that was much different. So we have to react to their expectations too. To do this, we're building new systems and we're seeking new partnerships with groups like OR Today Live or Manager AORN, and we are slowly changing the system. The biggest issue is to meet the accreditation standards, we have to do more than just track CE. We have to develop a system where you will do more and more meaningful things to maintain your certification. So we're moving to a system of professional development points where you earn points for doing different activities. CE is still a part of the system, it's just not the entire system. So for us, we are de-emphasizing the use of CE. We've not done away with it, but you can also earn points in other categories. For participating in professional organizations, doing reflections on your practice, and thinking about how you can improve and address your learning needs. Training certificates for things like attending ACLS, PALS, NALS. In the current system, unless you earn CE to take that class, there's no way to recognize your learning and give you credit. In a new system, we can do things like give you credit for points for attending training. I just looked at a certificate today from a nurse who attended a lean training exercise, and it was 32 hours long. It was an entire week of training, but CE was not awarded. In the previous system, or the system as it exists today, before we begin to change it, there was no way to acknowledge her learning there. There is a way to do that in a professional point system. And then we do things like case studies or listen to taped presentations, take quizzes, do crossword puzzles, listen to podcasts. All of those things, even if CE are not awarded, all of those things can earn you points and would work under a new system if we can justify it. But we have to look beyond CE and make other choices. The best part of all of this system, as difficult as this is, the turning of the battleship, the best part is in this new system, if you are certified with CCI, there's going to be no additional charge. If you hold our certifications, you have access to all these different points activities as part of your record-keeping system, and there will be no additional charge, period. You will have access to a considerable amount of CE, but also different activities which our accreditation agencies have told us are acceptable and will address your competency. All of these are part of a new system that we're going to transition to, but we have to make the choice to change the system. So this is what's in front of us in perioperative nursing and for CCI and those that hold our credentials. I talked to you in the beginning and I said, this is about choices. And what choices are you going to make in this changing landscape? The role of nursing is changing. And at CCI, our view is nursing could turn inward a little bit, evaluate the systems that we use for things like assessing our competency and ongoing professional development, form new partnerships, new arrangements, and we can strengthen it and make it better. And in doing that, we can meet the expectations of our stakeholders, the public, and we can also do things like meet the mandates of value-based care. The one thing that's clear in this uncertain environment, holding the status quo and not addressing your education, your learning needs is not a great option. The accreditation bodies are very unlikely to reverse their course and say, let's go back to older systems that are less sophisticated and don't actually address competency. That's very unlikely that will happen. The expectations of our stakeholders, our patients, and our family are not going to decrease. This is not a political thing and influenced about all the rhetoric about healthcare and how we pay for it. In general, the expectations of patients and their families continue to go up. They're better informed. They may be less trusting, and they're far less likely to just take our word for it. When we advise them, work with them, they will question, and their expectations are not going down. Those earning certifications now, there are different expectations for what does certification mean, and what does it mean to my continuing professional development. Again, I stress, standing pat and not changing, that is not a possibility. Even if we wish to do that, it just can't happen. The role of nursing is changing. We need to acknowledge that, and then we need to make choices. If we do acknowledge that, what choices will we make as a profession and as individual nurses, and where will that take us? We know that in all these choices about certification and professional development, there will be some fallout. And we also realize that there are some nurses that this is just too much, especially if they've been in the profession for many years, and there will be some fallout. So at this juncture, the system is changing, and for nurses, we have choices. We can choose to be certified. If we are certified, we can choose to go along with the new system and see how we can benefit from that and participate. All of these are choices that we can make. When I showed you the earlier slide of the person that was unhappy when we announced all the changes, that too is a choice. And you could say, this is not what I signed up for. I don't like it. I don't want to engage in this. I want to drop my certification or just let it lapse. All of those are choices that you can make. CCI's perspective here is there's also an opportunity, and we would like to engage with our nurses and the stakeholders in all of this and make some constructive choices and move forward together. And we would like to partner with our nurses to get there. So it is about choices. I'm a big fan of Shakespeare. I especially like the tragedies, but I like to go back to the saying, there's a tide in the affairs of men, which, taken at the flood, leads on to fortune. Omitted, all the voyages of their life is bound in shallows and in miseries. On such a full sea are we now afloat, and we must take the current when it serves, or lose our ventures. CCI thinks that even in these uncertain times, and you can see I go back to the nautical theme here, even in these uncertain times in the rough seas, we think we have choices to make, and we're hoping that we make a persuasive case and that the nurses that hold our certifications or aspire to that will make the choices and stay with us. We will change the system. We think nursing, perioperative nursing, will be better and stronger if we adjust to these times. And we believe that we can control our own destiny. And that's one of the choices we ask nurses to make. Adjust to these changing times. Come with us as we build a new system. That's one of the choices we're asking people to make. I have one last question because I'm almost done. For everything that I presented here to you, think about it. This is our last poll. As a result of this presentation, all these factors that I presented about the changing nature of nursing and the choices that we have to make, do you anticipate making changes to the professional development programs for you, your own choices, or for your staff, considering all of this and what I've presented? And Linda, I see that the poll is open.
Yes, it is. Jim, I will just give them a couple more seconds for everybody to vote, and then I will close it. Okay, I'm now going to close the poll. We have 59% who say yes, 9% say no, and 31% are unsure.
I'm not surprised that nearly a third are unsure. This is a lot of information to take in. And, you know, typically we don't spend a lot of time thinking about professional development and what does it mean to be certified and how does it all fit into a big picture of American healthcare. So if nothing more, I've given you some things to think about. I hope you found some of this useful. And we're not quite done with all the seafaring themes. This is a port. This is a port in France, I think on the southern coast of France. Faced with these choices, it would be nice if we could stay safely in the harbor, not worry about the rough seas. That would be great, but truly it's not possible. And there is some risk here in these choices that we make, but ultimately we think that we have to take the opportunity and sail and see where the tides take us. We think we have a window of opportunity here that we can help shape things as a profession. And so, again, something to think about, but we at CCI, we do not believe that just staying safely in the harbor and resisting change ultimately is the right solution. So at CCI, we'll take some risk. We'll be at the front of some of this and realize the risk, but we do think it's the right direction to go. So that concludes my presentation. Linda, I think I brought it in under time. And at this point, questions and comments.
Yeah, at this point, Jim, did you want to mention the special prize you are kindly offering?
See, this is why we go over all of this, Linda. Thank you. So CCI, we take all of this very seriously about ongoing professional development and the benefits of certification. It's our business. We're nonprofit. This is our place in nursing. In recognition of that, please take the survey. If you complete the survey, Linda will do a random draw from all the people that participated. Whoever, if your name is drawn, CCI, if you elect to take one of our certification exams in the year 2019, for whoever that individual is, I will waive your fees. Depending on which certification exam that is, that could be $390, $400, $450. We'll do that for one person. So complete your survey. If you don't yet hold CNOR, you could use it for that. If you're in a leadership position in the operating room, you do hold CNOR, you could use that for the CSSM, the leadership exam, the management exam. It is your choice. But that's a thank you from CCI for attending. And I believe everyone has stayed all the way to the end for all of our participants.
They certainly have, Jim. I've got a few questions for you. When will the CNOR certificates begin to feel these changes?
For those people who currently hold the CNOR certification, they will not be required to do anything different until the year 2021. If you currently hold CNOR, whatever choice you've made that you want to earn CE, whatever method you choose to recertify, you will not be required to make a change until 2021. If you are due to recertify in the year 2021, at that point, you'll recertify and you'll be enrolled in the new professional development points system and get access to all the materials on our website. But you just recert, if you choose by CE in 2021, then you'll begin a new 5-year cycle, and at that time, you can earn professional points, use CE for almost all of those points, but not all. You have access to other free activities on our website in that year. For those nurses who take the exam and pass in the year 2019, starting January 1st, those nurses will be automatically enrolled in the new professional development point system. So for the nurses in 19 and 20, they're in the system. They don't have an option. And then beginning in 21, we will, over a 6-year period, convert everyone eventually into the new system. Do remember, for those nurses who pass the exam on January 1st, they then gain access to a learning management system hosted by CCI. They will be able to earn all of their points through our system, and there will be no additional charge. You paid your fee for your certification. If you're an active certificant, you log into our system, do your activities, watch your videos, do your crossword puzzles, do your reflection activities, case studies. All of it is hosted on our website, and there are no fees. If you choose to attend OR Today Live, earn CE, there'll be a method that you can just enter your certificates in the system, but just be aware you will have to do some other things in the system to complete your research. You won't be able to do exclusively CE, but CE will still be a part of the system.
Okay, that's great. Thanks, Jim. The next question is, do you anticipate more changes in certification and recertification processes beyond what you have described?
I think that's entirely possible. I think when the ABS&C revises that Standard 13, there may be more coming. I can tell you the changes we've made at CCI. We have gone out and researched the best practices that we know that are out there, the most innovative ones that we know of, and built them into the system, which launches in January. We think at this point we're a little bit ahead of the curve, and even if things do change, we think we're going to be okay if we implement the new system. I can't predict everything that the accreditation agencies are going to do, but I think just like American healthcare, more changes coming. What we're trying to do is be as knowledgeable as we can, be proactive, and make sure that we keep our certificates advised of these changes which are mandated that may be coming. This is everything that I know of right now that I've shared today in this webinar.
Okay, so are other nursing certification organizations also changing their methods?
Yes, and in this point, there are other organizations, NCC, the Women's Health, Hospice and Palliative Care, Oncology, PEDS. They've all been doing this for 2 or 3 years now and changing their system. We're a little bit behind in that respect, but we've also learned from all of their examples. So in that respect, even though we're catching up a bit, we're not first here. So other organizations are changing too as they react to these changing standards.
Okay, I've got a we've got time for perhaps a couple more that have come in. One attendee is asking, does this affect anything if you have SNOR emeritus status?
Oh, that is a great question. For those of us who hold emeritus, and I hold emeritus for CSSM, there are absolutely no changes, no additional fees. You paid a fee, a one-time fee on emeritus status. You have no requirements to make any changes, or on emeritus status, there are no research requirements. And so absolutely no changes, but that is a great question. Thank you.
Okay, and another one, is an ambulatory surgery certification in the works?
Oh, these are good questions. The very short answer is an ambulatory surgery credential is under consideration by CCI. We have laid the foundation for that, and we are actively investigating the possibility. There's a strong possibility that we will launch an ambulatory surgery credential, because in our research in this area, there are some differences in perioperative nursing practice in an ambulatory setting versus a hospital-based inpatient setting. There are differences, and they are sufficient. There could be a separate certification. That is a definite possibility. I would say within 3 years, entirely possible.
Good, that's great. And is there an easier way to navigate the CCI website? One attendee says she's having difficulty trying to input her CEs.
You know what? I have an answer for you. You will see on that slide is a phone number. That is my cell phone, which is sitting on my desk right next to me. If you are having trouble entering CEs, navigating our system, here's what I would ask you to do. You send me a text to that number, and I will have someone call you within usually the same workday. Likely it'll be Emily from the CCI staff, and they will work with you to get that taken care of. So, you know, we had to update our systems, and it's different than it used to be when we dealt only with logging CEs. And there are places where it's not easy to navigate. We'd love your input on how we can make it better, but Emily will help you get your stuff in your record. You now all have my cell phone number, and you have my email. So if you have input for me, and you want to give input as a stakeholder, I welcome that.
That's great.
My phone is shut off right at the moment, so it wouldn't interfere. So if that blows up on me as soon as I turn it back on, I guess you took me to heart.
We've got time just for one more question, Jim. What is your recommendation if you are to expire in 2022? Will the AON CEUs still apply to recertification? And if so, what percent is CEUs?
Yeah, so if you were due to recert in 2022, 2021 and beyond, your next research cycle, you do not have to change anything. If you're due to recert in 2022 and you want to do CE, you are not required to change. We are not making anyone change in the middle of their research cycle. So in 2022, accumulate your CE. You'll need 125 just as you do now. Log them in our system and then research. At that point, you can have a choice. Your certification will be good for 5 more years. At that point in your career, you'll make a choice. You can do the work and earn your professional points. You're going to expire in 27, 28, something like that. And at that point, you could go emeritus. Your credential will be good till then using the current research method of CE. And then you can evaluate your choices until you get to that far horizon in 28. But if you are, we will not make people change the recert method in mid-cycle. If you're choosing right now to recert by CE, you will still be allowed to do that. Is that it, Linda? I think we're at time. I may have lost your input, Linda. So at this point, I'd like to say thank you for everyone who attended. And please fill out your survey, and I will now sign off. Thank you very much.